Okay, well, thank you for coming and viewing our poster. The poster that we're presenting today is Teleprom-Y. Teleprom-Y stands for Patient-Reported Outcome Measures, and the -Y means youth, because we had done a previous pilot study, and it was called Teleprom-G, G for geriatrics. So this one is called Improving Access and Experience of Mental Health for Youth Through Virtual Models of Care. And then down below the title, you can see that there's quite a few co-authors. Dr. Cheryl Forchuk is the principal investigator, and then we have the others listed beside that. We have a lot of sponsors, Lawson, LHSC, St. Joseph's. One of the big ones is Youth Opportunities Unlimited, where we recruited participants, Western University, and then we recruited from Woodstock Hospital and Ways Mental Health Support. And it's sponsored by, funded by Ontario Centers of Excellence. And one of our partners was Input Health, who designed the app. So the background for this study is the cost for mental health services and treatments exceeds 42.3 billion Canadian dollars per year. It's the second highest youth healthcare expenditure after injuries. And 1 in 5 youth have a mental illness, and 75% of mental illnesses have onset in childhood or adolescence. Mental health concerns disrupt important life transitions, development milestones, and can be burdensome throughout the lifespan. Smartphones have been successfully used to complement the treatment in a wide range of illnesses such as schizophrenia, bipolar disorder, and social phobia. So the Youth Telemedicine and Patient-Reported Outcome Measures study evaluates the use of remote care, delivery of mental health services for youth with mental health disorders. The platform that uses Input Health's collaborative health records, and that is an app that the youth download onto their cell phone, and they're provided a cell phone for the duration of the study and a free data plan so they can access the CHR. And that was Input Health. So the goal of the CHR is to improve access to healthcare and service delivery, facilitate proactive interventions by allowing youth to monitor their mood and behavior, and enhance care provider and patient communication, and improve the youth and care provider experience. So below that, we have a flowchart.
So this is an example of the CHR platform. So here we have an example of a patient named Jessica who is seeing her provider about anxiety symptoms. And then together they have decided to use the collaborative health record, or CHR. And the objective of using this app is to enhance patient care provider information exchange through digital interfaces. Jessica, using this app, can now report her symptoms and concerns through her phone and also receive tailored education. Her healthcare team can see her progress and message her, while also automatically receiving alerts if there are more urgent concerns. This app can also remotely monitor mood behavior changes for earlier intervention. Jessica can connect with her team through a secure video or a phone call, saving her time and giving her quick access to care. Which improves ease of access, and when she does come in person, her team saves time as their notes are auto-populated from the data collected between visits, and this allows for tailored care that connects patients closer to home while saving her team time and also collecting meaningful healthcare information, which overall improves the patient and provider experience. So the methodology of the study, it is a participatory action research study with mixed methods design. It's a longitudinal study using semi-structured interviews as well as focus groups. And the interviews were conducted at baseline, 6 months, and 12 months. There were 122 participants ages 14 to 25 recruited from 46 different care providers. And 3 focus groups of youth and staff were also conducted to examine experiences with the use of technology. Here is the purpose of the study. The semi-structured interviews, we had different instruments for that, including community integration, Lehman's Quality of Life Survey, the EQ50 Health Outcomes Survey, along with EQ5D Health Outcomes, Health, Social, and Justice Service Utilization Form, and also the Perception and Technology instruments. And focus groups were conducted with staff participants 6 months apart, and we looked at participants' experiences with the technology and also their perceptions of using the technology, or the CHR interface in this case.
So the participant characteristics, so 18.9% of the youth reported being homeless, 29.5% of the youth live with their parents or parent, 73.6% of the sample identified anxiety disorders, and 69.9% identified mood disorders. Of the subpopulation of participants who reported prior psychiatric admissions, the mean number of days since their most recent hospitalization was 50.
So what we found was that by the second interview, so at 6 months, only about 42% of participants did not actually use the CHR app on a regular basis. So we had just over half of the participants in our sample using the app. When we wanted to see whether there was a difference between those who did use the app and those who didn't, and whether there were predictors of whether or not an individual will end up using this interface. So binomial logistic regression was conducted to determine whether demographic and healthcare factors, including age, sex, and self-reported ratings of physical health and mental health, would predict whether participants use the CHR app. However, we did find that none of these variables were significant predictors of app use. So further research is needed to identify populations that will most benefit from mobile technologies.
And we conducted some youth focus groups. So some of the benefits that the youth told us was increased communication with their care provider. So by using the CHR, they could connect with their care provider using either text messaging or through email. And then the care provider would get it during working hours. It also, one of the benefits was availability of information related to safety plan, appointments, medication prompts, and wellness resources. The paperless format for completing forms was a benefit. Sometimes youth, when they're going to their appointments, sometimes misplace any kind of paper or forms that they have to bring with them. So this eliminated that. And the access to smartphone helped youth access supports and feel more connected, not only with their care provider, but with family and friends as well. So the areas for improvement, most of the youth that I spoke to complained about the login process. It was very, very lengthy, and that was something that the youth asked to have improved. And also the time needed to learn the functions of the app. So the conclusions that we had is mobile technologies may provide a more efficient approach to mental health care that enhances connectivity with care services. Disadvantaged youth found that the phone itself was just having a major benefit, and access to phones as well as the application presents participants with greater opportunities to seek additional supports and resources.
Thank you for listening to our presentation.
Yes, thank you.